Fifth disease, also known as slap cheek disease, is a viral infection. It affects mostly primary school children. It is a self-controlled illness caused by parvovirus B19. Children and those who interact with them are more prone to this virus. It happens all over the world during spring and winter. There is currently no vaccination and it's highly contagious via air and blood. Fifth disease is especially infectious right before appearance of the symptoms. Symptoms of fifth disease generally begin with low-grade fever, headaches, fatigue, nausea, and a sore throat as the virus spreads throughout the respiratory system and salivary glands. After a few days of these experienced symptoms, visual symptoms of fifth disease occur with redness on the cheeks followed by reticular exanthema, which is a pattern-like rash on the body or torso, occasionally reaching the arms and legs. The incubation period is usually between 4 and 14 days, but can be as long as 20 days. The rash itself is more common in children. However, the physical symptoms for adults is joint pain. The pain can last for several weeks and is generally experienced in the knees, wrist, and ankle.
The best possible outcome for fifth disease, if untreated, is for it to not cause any symptoms to come up. Studies have indicated that 40 to 60% of adults have laboratorial proof to have had the disease in the past, but a majority cannot remember. This implies that it is possible to contract the disease but not to experience any of the symptoms, or the symptoms that are experienced are extremely mild. Said mild symptoms could potentially include a slight headache, a rash, and events typically brought about by the flu. These symptoms can also be easily confused with other diseases or issues. For most patients with healthy immune systems, fifth disease has no prolonged symptoms and no long-term consequences. However, if your immune system is weakened due to other diseases, the patient will more than likely need a doctor's care for added support as your body fights off the disease. Fifth disease can also harm your unborn baby, as it is very dangerous to developing children. If it can potentially lead to anemia in your unborn child, which can result in their life being at risk. If necessary, a doctor may offer a blood transfusion to help protect your unborn child. The most expensive evidence-based approach of treating the disease involves the use of pharmaceutical medicine. Over-the-counter medication such as paracetamol, antihistamines, and anti-inflammatories such as ibuprofen all work to lessen the symptoms and the discomfort of those who are infected with the virus, as opposed to actually ridding the body of the disease. People who are infected whilst their immune systems are weakened often have difficulties overcoming the disease on their own. Such people can include those undergoing chemotherapy. In these situations, the disease can be present in a person's body for such a length of time that they can have a decreased amount of red blood cells. In situations such as this, blood transfusions may be required.
As mentioned previously, there is currently no vaccine available for fifth disease. Many cases go without treatment. It is treated according to symptoms such as fever, coughing, tiredness, joint pains, and a runny nose. Simply, the least expensive treatment is no treatment at all and waiting out the duration of the virus. Having no treatment at all means the infection can last as long as 20 days in children and several weeks in adults. However, this disease can be treated symptomatically, which will make the duration of the infection more comfortable for those infected, making this the ideal treatment method. Given that there is no vaccine for this disease, it is recommended that infection control methods are implemented to prevent spreading within high-risk areas such as households and schools. Fifth disease can be diagnosed by a doctor who would usually look at the appearance of the skin. Fifth disease does not usually require a referral as the body's natural immune system will fight off the virus, but the signs and symptoms can be relieved with paracetamol or ibuprofen.